So what are we talking about with minimally invasive dentistry? I've learned that in the trajectory of the demise of a tooth, there are certain predictable steps. It often starts with the very first cavity you have as a kid, and that tooth gets filled, and then you go along your life and that filling fails, and then you have to have a new filling, and that's a bigger filling. Now the surrounding good tooth structure is compromised. It might start getting cracks. And then pretty soon the dentist is talking about, well, it's going to take a crown to restore that tooth. And when we do crowns, which I do them all the time, I've done thousands of them in my career, but it does require grinding around the periphery of the tooth, a lot of the tooth's remaining enamel. That's another trauma to the tooth. So these teeth aren't just inanimate objects. They're vital organs within our body. They have a nerve supply, a blood supply. They have connection to the rest of the body in many, many different ways, depending on your field of study in energy medicine and in Chinese medicine, and just the fact that we know infected teeth can have an effect on the entire body. So we call that the dreadful story of a tooth's process. And it's dreadful to me because sometimes in our profession, we haven't always looked at what's the actual root cause of this entire trajectory. So in my evolution as a dentist, I've really committed to helping every single tooth within a person and within their chewing system to remain healthy and remain vital and remain within their mouth. And that takes some different intention about how you restore it. So I want to do less grinding. I want to do less traumatic things to the tooth in order to restore it. So I use a lot more direct composite restorations. I use a lot less porcelain, grinding, veneers, crowns than I used to. Those are still necessary at certain times. But I think that there's an incentive within our evolution as dentistry continues, and my own personal evolution as a dentist, to just keep the trauma to the teeth to a bare minimum, whatever's necessary and whatever can be done to help each tooth remain whole, vital, and healthy. That's my priority. If that sounds good to you, please give us a call and we can explain it to you further. And I hope to see you soon. Thanks.